for Achievement in Healthcare Research is Marie Claire King, Professor of Medicine and Genome Sciences at the University of Washington. A pioneer and world leader in cancer genetics and the application of genetics to human rights abuses, Professor King received the 2014 Lasker-Koshland Special Achievement Award for her contributions to medical science and human rights. Her early work demonstrated the existence of hereditary susceptibility to breast cancer through the discovery of inherited mutations in a gene she named BRCA1. Congratulations, Professor Marie Claire King.
Thanks very much. I'd like to echo what David and Matthias have said. Like David and Matthias, I came here as an adult, in my case 20 years ago, drawn to Seattle by the enormously generous donation from the Gates family of the resources to build a new department, Genome Sciences, out of what had been the best classical genetics department in the country and a very modern molecular biotechnology department, and to build us a building along with it. Because of the generosity of the Gates family, Paul Ramsey recruited me and originally about 10 and now 36 other faculty members, and we have had one hell of a time. All of us share with everyone that you've heard from already this evening the desire to take very basic results in our research. I grew up doing math and evolutionary biology, and to apply them to patient care. And this environment and this town offer us the chance to do that. I had spent my entire adult life in Berkeley, and I love Berkeley, and I still own my house in Berkeley. And once upon a time, 20 years ago, I thought I would retire to Berkeley at the age of 80 and hold a salon for unrequited lefties. But I think at 80, I'm still going to be in my lab, and I'm still going to be sequencing, and I'm still going to be figuring out what the genetic basis of inherited susceptibility to breast cancer are. And what this town has allowed me to do, because of you and colleagues like us, is to take a result that was important and elegant and a very nice result in basic science, and convert it now into a public health advocacy perspective, which is my proposition that all women be offered complete sequencing of BRCA1 and BRCA2 at about the age of 30 as part of a normal part of everyday clinical care for a cost of about $300 a woman, which is all that it costs using the technology that we have in this town. And that roughly 1% of women who learn that they have a devastating mutation in one of these genes, half of whom would never have suspected it because the mutations were inherited from their fathers, and there was no breast or ovarian cancer in the father, those young women can now make essentially a plan that extends over about a decade to have removal of the ovaries and fallopian tubes, and some of them may decide, like Angelina Jolie, to have prophylactic bilateral mastectomy, and we can reduce incidence of ovarian cancer by 23%, and we can reduce incidence of breast cancer by about 15% by simply doing that. There is no way I could have operationalized that program anywhere except this town. Thank you very much for welcoming me.